Now, for women, this becomes a really important thing for us to talk about because of the role of hormones as it relates to hypertension and specifically those hormonal shifts. Estrogen has a protective effect on our blood vessels, but as we age, as we get into perimenopause and menopause, and our estrogen levels decrease, then women become more susceptible to having high blood pressure. So I say that not to scare you, but to say that even if your younger days in your 30s, early 40s, you had no issues with elevated blood pressure, it's one of those things that as we go through perimenopause and as we go through menopause, we really need to make sure that we're keeping a check on. Are you a busy woman who prioritizes everyone else's health above your own? Do you have questions about your diet, exercise, or how to prevent or treat certain health conditions? Are you always Googling health questions that you forget to ask or are embarrassed to ask your primary care physician? Girl, do you even have a primary care physician? Well, welcome to Headed to Healthier. I'm Dr. Brittany Anderson, a board-certified family medicine physician, and every day in my private practice, I have discussions with women just like you who are doing their best to juggle the demands of life while also desiring to become healthier. Inside this podcast, you'll find practical and actionable health tips that you can incorporate into your daily life. You'll get expert advice and insight from some of my awesome healthcare colleagues, and you'll hear relatable conversations with incredible women just like you who have made their health a priority and are thriving because of it. So throw on your sneakers and get some steps in while you listen. Or if you're driving, get those hands at 10 and 2 and let's dig in. We are headed to healthier. Hey ladies, welcome back to today's episode. Today we are talking about something that I see every day, multiple times a day in my primary care practice, and that is hypertension. Hypertension is just another name for high blood pressure, and it is so common. Let me tell you just how common. 48% of adults in the United States have a diagnosis of hypertension. And here's an even more staggering statistic. 40% of people with hypertension don't even know it. So I don't want you to flip away from this episode and say, Dr. Anderson, I don't have hypertension. I don't need to listen to this one because I just told you that 4 out of 10 people who have hypertension don't even know that they have it. And I do not want you being one of those people. So let's chat about it today because hypertension is one of those things that really doesn't always come with symptoms. Now, someone who has really high blood pressure usually is going to have symptoms. They may have a headache, or they may have some blurry vision. They may have chest pain or feel a little bit short of breath, or they may feel dizzy or lightheaded. Those things come with high blood pressures, but most times folks will not notice it at all. And for that reason, hypertension is also sometimes called the silent killer. And it's called that because, again, people will have high blood pressure and they won't feel anything to go along with it. What makes me really alarmed in clinic is if I walk into a patient's room and I'm looking at their blood pressure that my nurse has checked and it's super high. And I walk in the room thinking that they're going to say that they've got a little bit of a headache or blurry vision or something like that. And they have nothing, none of those. They say, Dr. Anderson, I feel fine. I feel just like I feel every other day. Well, the reason that worries me is because that lets me know that their body has just adjusted to them having really high blood pressure, and they have probably had elevated blood pressures for a really long time. And so those are people that we've got to really make a significant and quick change to their blood pressures to get some improvement and to prevent those bad things, that sequelae of having hypertension, uncontrolled hypertension for a long time. So you may ask, well, what are those things? What happens if someone has poorly controlled high blood pressure for a period of time? Well, those things are they can have a stroke, they can have a heart attack, they can be set up to have heart disease or heart failure, they can have kidney disease or kidney failure, all kinds of bad things that happen if our blood pressure stays uncontrolled for too long. Now, for women, this becomes a really important thing for us to talk about because of the role of hormones as it relates to hypertension and specifically those hormonal shifts. Estrogen has a protective effect on our blood vessels, but as we age, as we get into perimenopause and menopause, and our estrogen levels decrease, then women become more susceptible to having high blood pressure. So I say that not to scare you, but to say that even if your younger days in your 30s, early 40s, you had no issues with elevated blood pressure, it's one of those things that as we go through perimenopause and as we go through menopause, we really need to make sure that we're keeping a check on. Now, whether you have a diagnosis of hypertension or not, I need you to do something for me if you haven't done it already. I need you to get a blood pressure cuff. Now, yes, I know you can go into these big box stores by the pharmacy or sometimes smaller pharmacies, and they have, that machine where you can go in and stick your arm in it and check your blood pressure with it. Those are not always accurate, but yes, they're certainly better than others. And I know that you can go into the fire department and they can check your blood pressure there, and that may be a way to sneak a peek at the firemen who are there. I feel you on that one. But there is no substitute for you having your own blood pressure cuff at home because I'm going to ask you to start checking your blood pressure at least once a week. So, once or twice a week, if you don't have a diagnosis of high blood pressure, but if you do have high blood pressure, you should be checking your blood pressure 2, 3, even 4 times a week. Now, I don't want you to be obsessive about it. I don't want you checking it 3 and 4 times a day, 3 and 4 times a week, but at least regularly checking that blood pressure. Now, when you buy that blood pressure cuff, I'm going to tell you my preference is going to be for you to get one that checks your blood pressure on your upper arm. Now, I know there's some out there that will let you check it on your wrist, and if you have a wrist cuff already, then that's absolutely fine. I am not asking or telling you to go buy another blood pressure cuff, but if you've not bought one already, get one that allows you to check it on your upper arm. It gives you perhaps just a little bit more of an accurate reading. Another way that you can know that your blood pressure cuff is giving you accurate readings is take it into your doctor's office. So I tell my patients all the time, I have no problem with you bringing your home blood pressure cuff in and you sit there and you check it with your home blood pressure cuff. In my office, we check blood pressures manually, meaning I or my nurse put a stethoscope in our ears. The other end of that stethoscope goes over your skin and we use a manual blood pressure cuff to pump it up and check your blood pressure to see what it is. So I'll ask my patients to bring their own blood pressure cuff from home. They check it with their cuff and then we check it with our ears because we know our ears are telling us the right thing, right? And so when we can hear and record that blood pressure, then we can compare it to what they get when they check it with their home automated machine. And so that's just a little way that they can know if their machine is giving them the right numbers because I certainly don't want you to think that your blood pressure is high and your home machine is just reading high numbers. But even scarier than that is I don't want you to think that your blood pressure is normal and your machine is completely inaccurate. So sometimes, especially on days that I'm not in clinic or like say I have to go away for a conference or if it's a slow day, we'll just post on our Facebook that, hey, bring your blood pressure machine by. Let us check your reading with your home machine and then let us check it with our ears to make sure that your machine is telling you the right number so that you know at least that when you check it, you can believe those numbers that you're getting. And let me tell you, sis, if you have an old blood pressure machine, and for me, old means if it's more than 10 years, girl, it's time for you to go buy a new one. If you have not changed the batteries in your blood pressure machine in over a year, it is time for you to change the batteries. So do those things for me before you even start checking your blood pressure at home. Again, just another way to make sure that you're getting some accurate readings. Now, when you check it, one of the most important things for me as a physician is I'll have patients come in and I'll say, have you been checking your blood pressure? And usually they say no. And I say, well, do you have a blood pressure cuff? And they say yes. And I say, well, how about you pull that thing out and you start checking your blood pressure? And usually they'll laugh at me, but hopefully they leave and will start doing it when they get home. But sometimes I'll ask them if they have been checking their blood pressure at home and they'll say, yeah, Dr. Anderson, I check it 2 or 3 times a week. And I'll say, well, what kind of numbers do you get when you check it? And they say, oh, it's normal when I check it. And I say, well, what's normal? And then I get just a blank look. And I say, well, you told me that it's normal when you check it at home. So what kind of numbers are you getting? And then they just start making up numbers. And the way I know that they're making up numbers is because they give me the textbook, oh, well, it's 120/80. And I'm like, well, sis, I'm looking at your blood pressure here in clinic and it's 146 over 92. So are you sure you're getting 120s over 80s when you check at home? And so one of the things I've started asking my patients to do, and that I really want them to do, and I want you to do this for your physician, is to start jotting down those blood pressures when you take them. So, grab a sheet of paper, on one column, write the date that you check it, and then that next column, write what your blood pressure is. Or even better, you can get one of those machines, the automated machines that has a memory drive to it, and it'll store numbers for you. And you can either take your blood pressure cuff into the visit with you, and your doc may go through those numbers. But I really like for my patients to just hand me a piece of paper that has it on it. So if you remember in the first episode, we talked about ways that you can prepare to get the most out of your doctor's visits. One of those ways would be to go back through that machine that's been recording those numbers for you and just writing them all down and being able to hand them over to your physician and say, hey, these are the numbers that I've been getting at home. So let's talk a little bit about what those blood pressures should be. I told you that when patients tell me their blood pressure is normal and I put them on the spot, they always go back to normal being 120 over 80. And for so long, that's what we told patients. And for so long, that's what we wanted. That sweet spot was for your top number to be 120 or better, and for your bottom number to be 80 or better. And I'll let you in on just a little bit of a secret. Sometimes we, as doctors and organizations, don't even agree on what a blood pressure should be for a patient. And what I mean by that is sometimes we say, well, it depends on your age, meaning if you're older, then we allow you to have a little bit higher blood pressure. Or it depends on if you have any other diseases, like if you have diabetes, we want you to have a little bit lower blood pressure. Or it depends on if you're looking at the recommendations from the American Heart Association or the Association of Cardiologists, or if you're looking at European cardiology association. So there are several numbers that are thrown out there. What I will tell you is that we certainly all agree that your top number should not be higher than 140 and your bottom number should not be higher than 90. So if you're checking blood pressures at home and you are consistently getting 140s and 150s on the top, and if you're getting 90s, certainly if you're getting 100s on the bottom, then let me tell you, friend, your blood pressures are too high. And I don't need you to get to the bottom of that page that you're writing numbers on. I don't need you to check it 10 days in a row to make sure that it's high for each of those 10 days. If you get two elevated blood pressure readings at home, I want you to call and make an appointment with your doctor to go in, to be seen, and to talk about your blood pressure and to figure out ways to improve your blood pressure. So that takes us into ways to control our blood pressure. And we'll start with folks who already have a diagnosis of hypertension. So if you have a diagnosis of hypertension, there's a pretty good chance that you have been prescribed blood pressure medicines. I'm going to tell you, like I tell my patients, those medicines do not work in the bottle, all right? They do nothing if you don't open the bottle, take a pill out of the bottle, put it in your mouth, and swallow it. You have to do your part. I do my part by writing the prescription. You got to do your part by taking it. One of my favorite things to say to patients in clinic is, hey, there's 7 days in a week. How many of those 7 days do you not take your blood pressure medicine? I found that when I ask them that way, instead of saying, hey, did you take your blood pressure medicine every day? Then I actually get the truth. And so picture this. So I say to a patient, hey, do you take your blood pressure medicine every day? They're going to say what I want to hear. They're going to say, yes, Dr. Anderson, I take my blood pressure pills every day. But if I go ahead and soften that for them a little bit, if I say there's 7 days in a week, how many of those 7 days do you miss your blood pressure pill? They almost always are going to say, well, I miss usually 1 day a week. Or even worse, they'll say, well, I miss 2 or 3 days a week. Now, my heart rejoices when they say, no, Dr. Anderson, I take them every day. I don't miss any days of the week, because certainly that's what I want to hear. But I've learned to kind of phrase that question a little bit differently. It's almost like it's saying, okay, I'm expecting you to miss a couple days of the week. And when they do, and they tell me that they do, then that is my chance to pay. Remember, I've told you that hypertension is a silent killer. I do not want this happening to you. I want you to make sure you're taking your blood pressure medicines every day like they are prescribed. Again, they do not work in the bottle. You have to actually take them out, put them in your mouth, and swallow them. So If you have hypertension and you are prescribed blood pressure medicines, I'm begging you to take them. Now, I know that all medicines come with the potential for side effects, so and blood pressure medicines are no different. So if you're prescribed a blood pressure medicine and it makes you feel a certain way, and for that reason you choose not to take it, I'd ask you to have a discussion with your doctor about it. There are so many different options for blood pressure medicines and so many easy changes that can be made to switch you to something else or to change the dose of your medicine if you get unwanted side effects from it. Now, whether you have a diagnosis of hypertension or not, there's certainly also other things that you can be doing to control your blood pressure, either to improve it if you have known hypertension or to prevent hypertension if you don't have that diagnosis. And those things, I'm going to read them off quickly and then we're going to go through each of them, are exercising, eating healthy, reducing your stress, and making sure you get adequate sleep. So let's take those things one at a time. First, let's talk about exercise. Now, when I say exercise, I mean not just, oh, well, I get up and down from my desk a lot through the day. No, friend, I want you getting 20 to 30 minutes of dedicated exercise and movement at a time, 5 days a week. So, again, there's 7 days in a week. 5 of those days, I want you hitting that 20 to 30 minutes of exercise. That gets you at that recommended 100 to 150 minutes a week of exercise that we want. Now, the next thing is eating healthy. And when I think about eating healthy, absolutely, I mean making sure that you're getting plenty of fruit and vegetables in your diet. But when it comes to talking about hypertension, what that also means is making sure that you're avoiding some things. And those things specifically that you need to make sure you're avoiding when we're talking about getting good blood pressure control or improving your blood pressure are going to be foods that are high in sodium. And so, sodium, the first thing we generally think about is salt. And that comes in when we are cooking or seasoning our food, just making sure that we're not going overboard with adding salt to it or that we're not using too many different seasonings and spices that once we put it all together, then we have just gone into sodium overload. What that also means, though, is giving your food a chance. Have you seen those people? My dad was one of them. Don't ever, if you meet him, tell him that I said this, but he would literally just sit down at the table and just shake salt all over his food before he ever tasted it, tried it, or anything. His automatic reflexive activity was to just pull for the salt shaker and start shaking it on everything. You don't have to do that. I want you to learn to actually enjoy the taste of food, not just drowning it out in salt, because we all know that when we get that increased amount of sodium in our body, then it really does lead to us having higher blood pressures. I also want you to think about foods that are high in sodium. And so I tell my patients, be wary of those foods in the middle of the grocery store. And so when I say that, what I mean is, dry foods that come in a bag or foods that come in a can. So for those bagged foods, I mean the chips and snacks and cookies and other things that when you look at the label on them, they have a high amount of sodium in them. I really want you to be careful about getting too much intake of those things. Other things in the middle of that grocery store are canned foods. And so generally anything that stays fresh on the shelf for a long time, you've got to think about, does this have extra sodium in it? And so canned foods are a really big one. And so if you will remember that previous episode that we had with Suzanne Henson, the registered dietitian and nutritionist, she gave us a really important tip, which was if you are going to do vegetables from a can, really making sure that you're rinsing those off. And so that's so important that you're rinsing them in water just to reduce some of that salt and sodium load that's in them already. I also, now this is not center of the store, this is on the outside of the store, but I want you thinking about pork foods. And so if you're someone who eats pork, you've got to do it in moderation. So that's our bacon and sausage and pork chops, those kinds of things. So really those pork foods can have a high sodium content. So I want you to just really make sure that you're being mindful of that. Next thing we'll chat about for a little bit is stress. And I say we'll chat about it for a little bit because I know that I have already planned some really great episodes to talk about ways to reduce your stress. But we all know that when we have so much going on in life and we're busy and we're working and we're dealing with kids and spouses and work and extracurricular things going on, then we can sometimes get a little bit overwhelmed and can get stressed out. And when our stress increases, our blood pressure almost always is going to increase as well. So, working on ways to reduce your stress, whether that's exercising, like we talked about earlier, if it's doing yoga or meditation or reading your Bible, taking deep breaths, whatever it is that you find that helps to reduce your stress, we want to do that because doing that will help to reduce your blood pressure and help you maintain an appropriate blood pressure as well. And last, but certainly not least, we'll talk about sleep. So, as adults, we should all be getting 7 to 9 hours of sleep a night. At least 7 hours we need. Now, you may be one of those people who says, Anderson, I do just fine on 5 hours of sleep. I'm here to tell you that after a while, that catches up with your body. And so, getting adequate rest and waking where you feel rested and are able to do the things that you need to do through the day, all those things are really important to helping to manage your blood pressure as well. So let's recap a little bit. Those ways to manage blood pressure that we talked about were taking medicines if they're prescribed to you, exercising regularly, eating healthy, reducing your stress, and making sure that you get adequate sleep. If you remember, I told you before, 48% of adults in the United States have a diagnosis of hypertension, and 40% of people who have hypertension don't even know it. The purpose of this episode, and one of my goals for you, is to make sure that you are not one of those people who has hypertension and doesn't know it, but also to make sure that if you are one of those people who does have hypertension and knows it, that you are doing everything you can to control those numbers. Remember, I said hypertension can be known as the silent killer, and I don't want that for you, friend. I want you making sure that you are living your best life and that you're living it at your best health. I hope that you learned a lot today. If you have not done so already, I would urge you to join our private Facebook group. It's called the Headed to Healthier Community. You can find it on Facebook. There are a couple questions that you have to answer to get into it, but we would love to have you. I can guarantee you that there we are going to be talking about hypertension, talking about ways to improve our blood pressure, and we're going to be talking about other health tips just as we continue on this path to getting healthier. I'm so glad you joined today. I'll be here next week. Talk to you soon. Bye-bye. Hey, thanks for listening in today. I hope something you heard in this episode will help you on your journey to becoming healthier. Remember, this podcast offers general health information. I am not your personal physician. If you need advice that is specific to you, be sure to consult your physician. If you enjoy this podcast, please consider sharing it with a friend and reviewing it on Apple Podcasts. Also, be sure to subscribe to the show so you never miss an episode. Tune in next week for another great episode of Headed to Healthier. Until then, take care of yourself. Talk soon. Bye.